So let's start to mention about some of the disorders that are comorbid with migraine. But let's maybe say that is, you see, we're two disciplines, dentistry or facial pain, and neurology and headache medicine, that we care of the craniofacial area. Is the same system, the trigeminal system, right? So one of the disorders that are comorbid, that we can see like a very link between orofacial pain dentistry and medicine, is temporomandibular disorders and migraine. So temporomandibular disorders and migraine and comorbid disorders. If the most common headache that the TMD population can present is migraine. And also I would like to say that temporomandibular disorders can give you a headache per se, but doesn't have migraine features. This is the headache that the patient, in the temporal area after they're chewing something that is hurting them. But these are two disorders, TMD musculoskeletal and migraine is neurovascular, but they can be comorbid. The presence of TMD is a risk factor for the progression of migraine. Can make the migraine more severe, more frequent. And we published like 2 years ago with Dr. Simon Ackerman a preclinical model to focus more about, to dissect the neurophysiological pathways of this comorbidity, because it's very common to see in the clinical setting. TMD is very common in women, it's very prevalent as well as migraine. So we were able to see that the presence of TMD, and already has been shown this, presence of TMD, as I mentioned, can help you progress to a more chronic migraine form. So just a few words about that. Imagine that any peripheral input coming from a TMD disorder, on the joint or the muscle, is extracranial input, has the capability to activate the trigeminal system in migraine. Imagine that pain in these structures kind of prime the system. If already your patient is a migraineur, that, or at least what we were able to see preclinically too, prime the system, kind of exacerbated even more this activation to the neurovascular system, like sensitized it, much more prone to have more pain, if I'm talking in lay terms, or like, or even like we see in the clinic, increase of frequency of headaches when the TMD is present. Another interesting thing is that in my previous work, we saw that the calcitonin gene-related peptide, CGRP, the key molecule involved in migraine pathophysiology, also is involved in TMD in a preclinical model. So that tells you a lot. And we were able to, so we were able to see that, and that was very interesting, because also what we published in this comorbid model was that CGRP also has a big role. So what about in different cases of patients, right? Maybe in the future, CGRP can offer as a monotherapy when both disorders are together. Of course, TMD has a particularities, and we will need to choose the right patient to have that. But just, it's something that makes you think. Another interesting thing, in the literature, we didn't find anything like association of dental pain with primary headache disorders. But dental pain can give you a headache, and we call it secondary headache attributed to dental pain or tooth pain or periodontal pain. But what we were able to see is that one of the dental pain, one of the most important structures that causes dental pain, that is involved in dental pain, is the pulp, the dental pulp. So guess what? The dental pulp, the most abundant neuropeptide in the dental pulp, guess which one was? CGRP. So that tells you a lot, and it's involved in this inflammation, edema, when this happens. Another association that we were able to see, or at least to look in the literature, has been shown that could be an association between chronic periodontitis and chronic migraine. So what's a study? What's only an association? Needs to be done a lot more research, but looks like, so let me explain what is periodontitis. So it's an inflammation of the periodontum, the structures, the tissue structures that surround your tooth, and can happen when the bacterial dental plaque has not been taken care of. So in this study was shown that serum levels of CGRP were elevated. So they found an association that what could be maybe systemic inflammation between periodontitis and chronic migraine. Of course, there's more things that needs to be done. But as I will say, that it's very interesting that CGRP is involved in the pulp. Looks like it's something going on in the periodontum. It's also involved in TMD, and is the key molecule for migraine. So still a lot of research are still going on, but you see these kind of commonalities make it very interesting.